What perspective will I be bringing, you said? I'll be bringing the perspective of a different health system. And what is becoming abundantly clear is all health systems are actually moving in the same direction. And that direction is trying to manage in a system which is clearly fiscally challenged, where we are all moving towards a capitated way of working. And the management of clinical uncertainty is particularly relevant. And the only way we can do that is if we tie in clinical behaviour and fiscal responsibility. So I'm bringing in really the experience of the English system and how we are actually moving in this direction. I think there are lessons to be learned, not necessarily from the progress, but there are mistakes we made which you don't need to make. The direction is the same. The direction is the same, and I think we are at a place in the journey, and you are in a different place in the journey. I don't think it's a question of who is advanced and who is less advanced, because we're further ahead in some places, but you're further ahead in others. What is abundantly clear is that we are all moving towards the same conclusion: how to manage a population with less resource, because clearly we are not in a place we used to be a few years ago. I think the message is a simple one. It just takes clinical leadership, it takes involvement of communities, it takes empowerment of populations. Those are the three fundamental aspects which we're all grappling with. I think your thought leadership is ahead in some places. I think you're embracing the population, and the way you're thinking about the population, I think, is ahead in some places. In some respects, the fact that we have been down this path for a while has caused us some difficulty, because we have currencies in place around the payment towards hospitals and also primary care, which are largely based on activity. You haven't gone down the same route, or you haven't developed that route as much as we have. And in some respects it's paradoxical, but because you are less down that route, it's easier for you to change the direction, which we all need to do anyway. So I think it's really useful for us to actually work together, because, as I said, we're in the same boat, and we're trying desperately to find a way through the difficulties we have over the next few years.